In today's lecture, we will discuss about study designs in qualitative research. Okay, so study designs in qualitative research, they are case study, oral history, focus groups or group interviews, participant observation, holistic research, community discussion forums, and reflective journal logs. Now, one by one, we'll go into details of this. Now, case study. Case study means what? You take that as one particular case. It may or may not be applicable. Means generalization is not possible in this particular case because you have taken that particular case and you will explore that case in depth, or there is in-depth exploration of that particular case or condition or situation or phenomena. So generalization means what? Generally in quantitative study, what we do, we work on a certain sample. Maybe suppose there is 130 crore population of India. So instead of working on all the population, we select some thousand representative population of India, and whatever findings we get, the findings are generalized. Findings are generalized means the same findings are applicable to remaining population. Now, in this case, when you are dealing with a case, you want to have in-depth exploration of a particular situation or condition. So in this situation, it may not be possible to have generalization of the findings because whatever findings you get it from the case study, it may not be possible all the time to apply it to other cases, similar cases or different cases. So a case could be an individual, a group, a community, an instance, an episode, an event, a subgroup of population, a town or city. So that becomes a case. Means suppose you want to work on a particular situation like Bhopal gas tragedy. It was a horrible situation that happened long back. Now, suppose you want to study it as a case study. So what you will do, you will study that particular situation. You will study that particular instance or you will study that particular phenomena. The community was involved. There are so many harmful effects like physical effects, emotional effects, right? So all the kinds of effects were imposed on that particular population, or after effects, like after that tragedy, still the people are suffering from that particular after effect phenomena. Right. So all that you want to study as a case study. So you can study that situation like Bhopal gas tragedy can be one case study. You can study it as a case study so that you will have in-depth exploration of what happened on that particular day, how people suffered, who did that particular crime, and other aspects related to that particular tragedy that you will explore in depth. In a case study design, the cases you select becomes the basis of thorough, holistic, and in-depth exploration of aspects that you want to find out about. So here, what you want to find out about, you want to have in-depth exploration. You want to have thorough understanding. You want to have holistic understanding of that particular situation or phenomena. So you want to explore in depth what happened on that particular day, what happened after that day, and what is happening till now, how these people are suffering, how many people suffered, right? Through what emotional trauma, to the what physical trauma they have gone. So all these things you when you study in holistic way, when you study in 360-degree way, it becomes your case study. It is very useful design when exploring an area where little is known. Suppose you are studying an area where small amount of information is available and you want to have in-depth exploration. You want to get entire information in that particular situation. This is the one of the important way of studying that particular situation. And case study will be helpful to arrive at or getting in-depth exploration of that particular situation. So it is a very useful design when exploring an area where little is known or where you want to have holistic understanding of a situation or phenomena or episode or a site or a group or community. So whenever you want to have holistic understanding of that particular situation, phenomena, episode, site, group, community, this particular design is very much helpful. It provides an overview and in-depth understanding of the case or cases. So it will provide in-depth understanding what happened on to that people, or what happened in that particular situation, or what happened in that particular phenomena. In-depth understanding and in-depth exploration of that particular case or cases, processes, and interactional dynamics within a unit of study, but cannot claim to make any generalization to a population beyond cases similar to the one studied. So it may be unique situation. Bhopal gas tragedy is a unique situation. The findings of Bhopal gas tragedy you cannot apply to any other situation, right? So it is a unique situation, and the case study information will be helpful to arrive conclusions from that particular study only. Generalization of that particular study is not possible. Generalization with other phenomena is not possible for Bhopal-Grass tragedy. So generalization to a population beyond cases similar to the one which we are studying is not possible in case of a case study. Right. So what do we understand by case study? In case study, we want to have in-depth exploration. In case study, we want to have a holistic understanding of that particular situation or phenomena. We want to explore an area where little information is available, right? So we study that particular situation, we collect the information in depth, and we come to a conclusion. But that conclusion is applicable purely to that particular case. It is not applicable for any other cases or many other cases. So generalization is not possible in case of a case study. But it is very good method when you want to have in-depth exploration of one particular situation or phenomena. When you want to understand that particular situation or phenomena in depth, that is called as a case study. Coming to next, that is oral history. So oral history is more a method of data collection than a study design. So oral history means what? It is method of data collection as well as it is a study design in qualitative research. So in qualitative research, there is no clear-cut demarcation between study design and method of data collection. Our next chapter will be on method of data collection. So method of data collection means what method you are using for data collection. Now oral history is used as a study design in qualitative research as well as it is used as a method of data collection. Hence, it is said that there is little demarcation between method of data collection and study design in case of qualitative research. It is a picture of something in someone's own word. So oral history means history taking. You are taking somebody's history, what happened in the past or what happened with the current situation. Okay, so whenever you take that history, whenever you take that information, it is called as oral history. Oral history is one of the popular methods in health sciences. Generally, students during bachelor's or master's, they take history. It is a regular practice for them. So taking history is a regular practice so that they get information about patient situation. Similarly, it is applicable to other fields for taking historical data or taking current data. Maybe you can take historical data, whatever happened in the past of that particular situation of phenomena or what is happening currently. So that when information you take it from the people, from the organization, from the community, from phenomena, from situation, then it is called as your oral history. Okay. So going back, oral history is more a method of data collection than a study design. It is a picture of something in someone's own words. So somebody is narrating this and you are writing it. Oral history is a process of obtaining, recording, presenting and interpreting historical or current information. So you obtain the information, you record the information, you present the information and you interpret that particular historical or current information based on the personal experiences and opinions of some members of a study group or unit. So it is based on the personal experiences and opinions of some members of a study group or unit. Okay. So that is about oral history. Means in oral history, what you do, it is a process of obtaining, recording, presenting, and interpreting historical or current information. Okay, it may be based on personal experiences. It is applicable to a population. It may be applicable to particular situation. It may be applicable to particular phenomena, and that we call it as a oral history. Now, focus groups or group interviews. So focus groups are a form of strategy in qualitative research in which attitudes, opinions, or perceptions towards an issue, product, service, or program are explored through a free and open discussion. So it is a focus group. There is a group interview or it is a focus group which is having free and open discussion. If you're watching television and if you're watching especially the news channels, they take one particular situation, they take one particular problem and experts are called on the dais. So the experts will discuss about that problem. They are experts regarding that particular situation or phenomena. Okay, so anchor will ask the question regarding that particular situation and phenomena and he or she will collect information from each expert. Okay, means there is a focus group. There may be 8 to 10 people who are giving their idea, who are giving their ideology regarding that particular situation or phenomena. And that is a focus group discussion or that is a group interview. So it's a free and open discussion between members of a group and the researcher. So researcher means if you see a TV anchor or the person who is taking an interview, that person is researcher, that person is investigator. And those who are answering, those who are discussing, those who are having free and open discussion, the members which are called expert members, which are called, they are a part of that focus group. Because of its low cost. See, now you are dealing with a situation where you have called all the experts on one particular dais, on particular area, and you are taking information from them. At a time you are taking the information from them at that particular situation, or for that particular cross section you are taking the information. So definitely it is a low cost, because you need not have to go to each person, you need not have to have different questions, or you need not have to have different setup for each person. So there are experts have come, they have knowledge about that particular situation or phenomena, and you as a researcher, you are asking questions to them and collecting the information. So at a time, all the experts are giving their opinions about that particular situation and phenomena, and you are recording it, and then you will interpret in the future. So it is a low cost. So it is a popular method for finding information in almost every professional area and academic field. So professional area means you check your conferences. Whenever you go to conference, what happens? There are people who are experts in your field, okay, and there are some problems in the field. Or one of the problems from the field is taken, and about that problem, the experts talk. Like there are people who will ask them questions, or there are researchers who will ask them questions, and the information is taken from those experts. So they will give their opinion. They will give their expert opinion regarding that particular situation or phenomena or that particular research problem. Approximately 8 to 10 people are the optimal number for such discussion groups. So generally we see that there are 8 to 10 people who are experts regarding that particular situation or phenomena, and they are called for this focus group discussion or group interview. The main difference between focus group and group interview is the degree of specificity. So focus group is more specific regarding that particular research problem as compared to group interview. Group interview may have varying degree of specificity. It is less specific as compared to focus group, but focus group is more specific as compared to group interviews, right? So the degree of specificity is different in case of focus group and group interviews. Focus groups are more specific, more focused regarding that particular research problem, regarding that particular situation or phenomena as compared to group interviews. The information generated can be detailed and rich and can be used to explore a vast variety of issues. So you are getting what? True information. You are getting information from the experts. You are getting information from the people who have deep understanding about that particular situation, phenomena, or that particular research problem. And you are collecting directly information from such experts. Hence, whatever information you are getting, that information is rich information, that information is detailed information, and you can explore vast variety of issue out of the experts' opinion. Whatever opinion you are getting from those experts, you can explore vast variety of issues related to that particular research problem. Okay. So this is about focus groups or group interviews. Next is participant observation. Participant observation is another strategy for gathering information about a social interaction or phenomena in a qualitative study. So here what you are doing, you are living the situation. Participant observation means you as a researcher, you are a part of that particular group. You are part of that particular situation. You are part of that particular phenomena which you are studying, right? So you are not just a researcher, you are researcher as well as you have active participant for that particular group. That is called as participant observation. Okay. Participant observation is another strategy for gathering information about a social interaction or phenomena in qualitative studies. This is usually done by developing a close interaction with members of a group or living in the situation which is being studied. You as a researcher, you will live that situation, or you will live in that particular situation which is being studied. Okay, the problem under study, you will leave that problem. The main advantage of participant observation is that you spend sufficient time with the group in group or in that particular situation. So you gain much deeper and richer and more accurate information. So what is happening? You are giving your time. You are a part of that particular situation. You are part of that particular group. Hence, you get a richer information because you will come to know different aspects of that particular research problem, phenomena, or that particular situation. You are actually living that particular situation. You are actually living that particular condition. Because of that, you are getting richer information, deeper information, in-depth, accurate information regarding that particular situation or phenomena. And that is the most important advantage which is associated with the participant observation. You are not a passive observer. You are actually a part of group. You are researcher as well as you are a participant. So you are living like a participant and not just a researcher. So that is a advantage which is associated with the participant observation. Main disadvantage is that if you're not very careful, you can introduce your own bias. Now, see, we are human beings. We are not machines. The emotions are attached to human beings. The likings and dislikings are attached to human beings. So when you are a part of that group, you might get sympathy of that particular group situation, group or phenomena, or you will try to hate that particular situation, phenomena, or that particular group. So either way, whether it is positive or whether it is negative happening, in both the way, you will introduce the bias because you have something in your mind that has come out of what? That has come out of the experience. Out of the experience means because you are living with the group, you are living that particular situation, you are living that particular phenomena, and hence you are actually living that particular condition. Because of that, you understand all the aspects related to that particular situation and phenomena. So you will either gain sympathy about those people or you will try to hate those people. Okay, and that will introduce the bias because you should be a neutral person. Whenever you are analyzing, whenever you are interpreting, whenever you are concluding, you should be a neutral person. But it is difficult because we are not mechanical things. We are not machines. We are not, we cannot be unhuman. Okay, so that is inherently attached. You cannot separate. You cannot have a separate entity, physical entity and emotional entity. It is attached things, and automatically you will tend to introduce your own bias in this particular situation in participant observation. Okay, so participant observation is what? In participant observation, basically, you are part of that particular group. You are part of that particular situation. We are part of that particular phenomena which is being studied. And you actually live in that particular situation or condition. So in participant observation, you are active participant and not just a researcher. So you are researcher, you have a dual role. As a researcher, you are researching, and as a participant, you are participating in that particular situation. The most important advantage associated with this particular study design is you get deeper information, you get richer information, you get more accurate information because you are living that particular situation, condition, or phenomena. But disadvantage is that since we are human being, emotions are attached to all the human beings, and you will try to introduce error because you are living that particular situation, because you are living with that particular group. So you will have likings or disliking related to that particular group, and that is the disadvantage which is associated with the participant observation. Holistic research. So holistic research is a philosophical concept in qualitative research. Holistic means 360 degree. From you are looking that particular situation, phenomena, or that particular research problem from a 360-degree angle, from holistic way. Okay, so holistic approach to research is once again more philosophy than a study design. So it is more of philosophical based thing, and most of time it is used in social sciences. Okay, so those who are from the social science background, most of time they use such kind of philosophical approach for designing their research. To understand a situation or phenomena, you need to look at its in totality. So from 360-degree, from all the aspects which is associated with that particular situation, phenomena, or problem, you have to look it in totality for towards that particular situation or phenomena. Holistically from every perspective. So each and every perspective, each and every variable, each and every problem related to that particular research phenomena or that particular research situation should be studied. Means from all the angles, from all the aspects, it should be studied, and that is called as holistic research. Okay, so it is more of a philosophical kind of thing than a practical kind of approach. Community discussion forums. Again, it is extensively used by the people from social science background as well as even from government organizations. They use community discussion forums. Now, community discussion forum, the name itself suggests that discussion in presence of community. So related to community problems. So there are forums which will discuss community problems so that those problems will be taken care. Those problems will be taken care by the people. Those problems will be taken care by the government, or those problems will be taken care by the authorities, right? So community discussion forums are designed to find opinions, attitudes, and or ideas of a community with regard to community issue or a problem. So there might be n number of community problems. Okay, community sanitation, community health programs, right? Maybe traffic management. So there might be n number of community problems, and all those community problems are discussed under community discussion forums, and the solutions are solutions are suggested to authorities regarding that particular problem or regarding that particular community problem, right? Such forums are also used for a vast variety of other reasons, such as developing a town planning. So town planning options means suppose how town should be developed, what facilities the town should have. Okay, now there are so many things which are needed for one particular community. One particular community means human community. Okay, they require good roads, they require transportation things, they require financial institutions, they require educational institutions, they require hospitals, they require other infrastructure as far as their day-to-day living is considered, and maybe things like phones, internets, all things are required, and that is a part of town planning. Okay, developing a town planning. So it is again part of community discussion forums or community health programs. generally government have such kind of community health program. There are n number of programs which are introduced by the government. Government work on those programs and they implement, like they take the data, they conclude based on that data, and that conclusion is applied. That conclusion is applied for future generations or the same generations. The whatever findings or whatever outcomes are there, those are applied. Okay, seeking participation of its members in resolving issues related to traffic management. So there might be problems related to traffic management. So in community discussion forums, the people will come on that particular area. Okay, so it is an open discussion forum. It is open discussion forum, and the opinions are taken from those who are sufferers, as well as opinions are taken from those who have ability to take care of those problems, right? So all these people, they study the situation, they conclude the situation, and they try to solve the problem. So basically, it's a research problem, and they try to find out solution to this research problem. Okay, informing community of new initiatives. So if there are some certain new initiatives in that particular community or that particular area or that particular region, all that is informed to this community discussion forums. Okay, so community discussion forums, again, it is a part of social science. Most of time it is used for community. The name itself suggests that these forums are useful for community problems. Means whatever discussions are happening, these are discussions are related to community problems, and these are not individual research problems. Okay, so these are all community research problems. Reflective journal logs. Okay, so reflective journal logs means keeping log or keeping a record of all the activities that you do regarding that particular research problem or research phenomena. Suppose you are studying one particular situation or one particular research problem in a qualitative way. So what you will do, you will meet the participants, you will meet the experts, you will meet your friends, you will meet many people. Maybe every time you will discuss this particular situation, problem or phenomena with these people, and whatever findings you are getting, you will have your records, you will have your logs, and all those findings, whenever you are discussing or after discussion, you will take a record of all those findings, and that becomes your reflective journal logs. So in the end, what you will do, you will submit all those reflective journal logs, and you will try to have conclusion, or you will have to have some kind of data from that particular reflective journal log. So keeping a reflective journal log of your thoughts. So here what is written? It is reflective journal log of your thoughts, whatever comes to your mind. Maybe you are traveling, maybe you are studying, maybe you are playing, maybe you are into your professional area. So whatever thoughts that are coming related to your research problem under study, you are studying a particular research problem, but the thoughts which are coming to your mind while doing other activities, all those are recorded as a reflective journal logs. So keeping a reflective journal log of your thoughts as a researcher, whenever you notice anything, like whenever you notice something related to your research problem, or you talk to someone, you talk to participant, or you participate in any activity, or observe something that helps you to understand or add whatever you are trying to find out. So whatever research problem you are studying, if anything related to your research problem, if any information related to your research problem can be added from your particular condition. Suppose you are playing, or you are on a ground, or you are doing some other activity. So in that situation, if you are getting some additional information related to research problem, you will transfer that information to your journal log, and that becomes your reflective journal logs. These reflective records then become the basis of your findings and conclusions. So you will conclude, you will have your data, you will have your data from these thoughts only, right? So whatever thoughts, whatever interactions, whatever things you are recording as your thoughts, so all those will be your reflective records, and they become basis of your findings and your conclusions. So that is the reflective journal logs. Other commonly used research designs.
Excuse me, sir.
Yeah.
I just wanted to, can you give us an example of holistic research? So does it mean that suppose a particular problem is being studied, and I'm approaching the problem from, let's say, the sociological perspective, the anthropological perspective, then the biological. So does that mean holistic or?
Yes, now suppose we are into this era, 2023, and suppose today you want to study Bhopal gas tragedy. We are not totally
Mhm.
aware about what exactly happened. Like even we have not studied in depth. Okay. So
Okay.
suppose you are curious about that particular situation or phenomena. So you forget that you are a doctor. You are into some other social. You have a social science background, and you are wondering about that particular situation. What happened in Bhopal gas tragedy? How that tragedy happened? Who are responsible people, how people got suffered, what happened on that day, what happened after that day, what is happening till now. So holistic means you will study all the possible aspects related to that particular situation or phenomena, and that becomes your holistic research. Okay, means you have taken one situation, that is a Bhopal gas tragedy. and you are studying it from 360-degree angle. You are not leaving any part of it unstudied. Okay, so you are studying everything, all the aspects you are studying regarding Bhopal gas tragedy, and that becomes your holistic research.
Okay. Okay. Thank you.
It's a qualitative research. You may not get any quantitative data in that, numerical data in this. Okay, so it is more of a qualitative phenomena. We are dealing with the qualitative research. Okay,
Okay.
so it is more
So, and
flexible kind of thing.
so, and in case studies, along with qualitative, quantitative measures can also be used, right? In case
You can
studies,
have
or
mixed data. You can have mixed data
mm,
in
mm.
case study.
Oh,
If you can have, see, whenever you are recording information only in the form of text, then it becomes a purely qualitative research. When you have some kind of data where parametric data is applicable. Parametric means what? You can have average, you can have a standard deviation, you can have variance. When such parameters are applicable to your data, then it becomes a quantitative study. So your study can be mixed type of study. You can have quantitative as well as qualitative approach. Only at the end, like when you are applying test of significance, it is only applicable for your quantitative data, parametric data. Non-parametric data, the analysis is different, and parametric data analysis is different. Means quantitative data you have to analyze in a different way, and qualitative data you have to analyze in a different way. Okay, so you can have a mixture of both.
So actually, I would
okay.
just
Okay.
like to add to what just Amrita ma'am said, that sometimes, like in medical field, we have some rare conditions or diseases in which we don't get a large sample size. So in that case, we just have a single case study of patient whose data is usually quantitative. So in that case, will it be a mixed or pure case studies can be purely quantitative? Is that possible?
No, no, it is a pure qualitativeness. So if it is a case study, you are saying it's very rare case. Suppose
Hmm.
out of 10 crore, only one person is affecting. Out of 10
Yes, sir.
crore, only one person is affecting. Means suppose there are 140 crore population of India, only 40 people
Right.
in India are affected that particular situation or phenomena. So
Hmm.
generalization is not possible in this particular situation. Okay,
Right,
whatever
sir.
findings you are recording, those findings may be applicable to that particular situation. Maybe that
Hmm.
are applicable to that particular patient, right?
Hmm.
So it's a very rare condition. Generalization is not possible. And even you are recording, suppose I am giving general thing. I don't know the situation or I don't know the disease. Suppose you are recording that person's blood pressure or you are recording that person's sugar level. So it is applicable for that particular case, and it may not be generalized. You cannot generalize the findings. Whatever findings you are
Right.
getting, you cannot generalize. So you cannot
Generalize.
transfer. See,
Hmm.
if you want to have average, you should have a data points. You cannot have
Right.
average for one particular patient. Suppose you are
Yes.
recording one particular patient's particular parameter,
Hmm.
disease or non-disease parameter, healthy parameter
Hmm.
or disease parameter. So
Hmm.
it will not have standard deviation. It will not have many other aspect like variance,
Right.
or you cannot calculate average.
General
So it
tendency.
cannot be
Right.
a parametric data applicable only
Hmm.
to
Hmm.
that.
Hmm. Hmm.
And generally it is published as a case study only. So whenever you are going to publish, you label it as a case study, and it is published
Okay.
under case study. Then there are other commonly used research designs, and these are action research, feminist research, and participatory and collaborative research inquiry. So one by one, we'll go into details of this. Now, action research, the name suggests that you have to take some action. So here there is some research problem, there is some felt unmet need, or there is some intervention. Now you want to study that particular research problem in depth. You will study that research problem and you will arrive to some conclusion. Means how will you arrive to conclusion? You will have that intervention. Okay, you will study that research problem. You will have your research design. You will have intervention. You will collect the data, and after collecting the data, you will analyze the data. After data analysis, you will conclude what is important. Means you will have conclusion. You have a research problem, and at the end of study, you will have conclusion in your hand. Now, whatever is your conclusion, that conclusion you will apply. Apply means what? You will take action. Suppose there is some problem in the community. Like suppose we'll go back to our COVID era. In COVID era, what we learned, use of mask will help to reduce the spread of infection. So initially what government did, government asked many people, like suppose they have a sample size of 1 lakh. They asked 1 lakh people to use mask, and they also observe people who are not using mask. Among those 1 lakh people who are using mask, how many got infection or how many could transfer the infection, they checked. And among non-users, how many transferred or how many got infected. So if they found that suppose 80% of the people who are not using mask, they got infection and they transfer the infection, as compared to only 20% of people who are wearing mask, they transfer or they got the infection. So means it's a statistically significant data. Now what they will do in next step, they will take action. What action they will take? They will make it mandatory. Why government is imposing? Suppose there is fine during COVID era, we had to pay fine if we were not using the mask. Means why government implemented that? It is a part of the action research. So government studied that use of mask will help to reduce COVID spread or COVID infection by 80%. Right? After this study, they applied this. They took action in the form of making it compulsory for everyone to use the mask. If you do not use mask, you pay the fine. Okay, so people will again use the mask. Means government has taken action, and this is a part of the action research. So in action research, what is done? You have a research problem. You will take that research problem, you will make a study design, you will collect the data, you will analyze the data, you will conclude the data, and based on the conclusion, you will take the action. Okay, and that is called as action research. So here we are. In the beginning, we have some felt unmet need, or we have research problem simply. We will have research design in place, and we will have intervention or a program. Okay. Why we will have intervention? Because we want to collect the data about that particular research problem. Research problem. We have collected the data. This is the research process. Research process is to collect the data. Data is collected. Data is analyzed. Data to draw conclusions with respect to area of concern. So we had our research problem. We have a area of concern. We collected the data and we find out the solution for that particular research problem. Now suggestions. Changes to deal with the concerns, means whatever was the research problem, whatever were the concerns, we are now dealing with the that particular concerns. How? By taking action, by introducing the changes or by taking action. So we will take the action so that that particular problem will be taken care. That is called as action research. This action research techniques establish the prevalence of the problem. Means prevalence means total problem. What was the total problem about that particular? What was the total problem in the community regarding spread of infection? So it is the sole way, or if there is some other way, or it is the major way. Major way means it is the one of the dominant way of reducing spread of infection. If we study that, we will come to the know the prevalence. Prevalence of prevalence rate of transfer of infection among users and among non-users. So that information government will get, and based on that they will decide. Or the importance of an issue so that appropriate action can be taken to deal with. Suppose government is studying that utility of mask, whether mask is really helpful in reducing spread of infection or not, and they find that only 0.1% population is helping. Like only that much of spread is possible. Stoppage of spread of infection is possible. Then they may not implement this policy because we have such a huge population. And if we ask them for unnecessary thing, means that may not be required. So they will have some conclusion, they will have some data, they will have some inference in hand, and based on in the inference, they will decide whether to go ahead with that action or they have to stop the action. Means either way they are taking the action. They either they are taking the action or they are not taking the action for that particular situation or phenomenon. Feminist research, again, it is a part of social science, and generally it is a way of conventionally teaching, or it is mentioned in the conventional textbook. So feminist research, by the word you understand that it's a research which focus on the experiences and viewpoints of the female or women. Okay. So the goal of feminist research is changing social inequality between men and women. So majority of time it is a part of social sciences. So the people who are from social science background, they take such kind of research, that is feminist research. Feminist research may be classified as action research. So whatever problems which are associated, now here the area is very specific, related to problems of the females or the problems of the women or viewpoints or experiences of the women. That is the specific area. So feminist research may be classified as action research. Action is taken only for the problems related to women in the area of gender inequality, using the research techniques to create awareness of women's issues. So whatever are the women's issues and concerns, those are studied and the action is taken, and to foster action promoting equality between the gender. Next is participatory and collaborative research. So we can have a participatory research or we can have a research with the collaboration. Active involvement of research participant in the research process. Generally what happens whenever you undertake any kind of research activity, research problem or research project, in that you are a researcher or investigator, and the research participants are the participants. They will just give you the information. They are passive participants. Okay, they are not actively doing any kind of research, or they are not giving active feedback related to your research process. When the participants are active in terms of they are active part of your research process, then it is called as a participatory research. So active involvement of research participant in the research process is your participatory research. So participatory research is based upon the principles of minimizing the gap between researcher and research participants. Means what is the researcher doing? Researcher is collecting the information. He's an active force who is driving that particular research problem or research project. Now these research participants, the participants who are a part of the research process, generally they are a passive component. Now they are becoming active and they are also driving that particular research problem, research process or research project. Then it is called as participatory research process. Participatory research is based upon principles of minimizing the gap between researcher and research participants. So there is a reduction in the gap of researcher and research participants and increased community involvement and to participation to enhance relevance of research funding to their needs. So whatever are the needs means basically they are active part of their research process. They are active part of that particular research process, phenomena or situation or condition, so that they will also give their feedbacks. They will also help that research process so that the data is collected and they will come to some active conclusion. In these designs, you are not merely a researcher, but also community organizer because you are dealing with so many people. You are asking them to be part of your research process. You are asking them to be part of active participant of that particular research process. As a researcher, you work at two different aspects, that is community organization and a research. Means you are collecting the data as well as you are organizing that particular event. You are organizing that particular situation or a phenomenon, and that is called as participatory and collaborative research. So we are done with the research design. Research design is complete. Both research design, like research design in qualitative research or study design in qualitative research and study design in quantitative research. So we are done with both the things. This was the major topic, and here most of the points are covered under research design in quantitative research, because quantitative research design is fixed research design where you have parametric data. You are dealing with the parametric data and you have to apply multiple tests for that particular parametric data. Qualitative research is always flexible kind of research. Okay, so generalization may or may not be possible in qualitative research, and qualitative research is always dealing with somebody's perception, somebody's emotions. Okay, so it is always expressed in the form of text, and quantitative research it is always expressed in the form of numbers. Okay, numerals, it is expressed in the form of numerals. So it is very strict or rigid kind of thing. Quantitative research designs are very rigid thing. So if you're dealing with the quantitative research, if your study design is falling into a quantitative research, put 80 to 90% of time in research design alone. I am saying put 80 to 90% of time in research design, because if your research design in quantitative research is proper, then only you will be able to have proper conclusion of your research data. Data collection is an easy process if you have research design in place. Okay, so focus maximum time on your research design if you are dealing with the quantitative research. In qualitative research, this is not a situation. Even at the end, you can add your parameters, you can delete your parameters. It is the most flexible kind of research, which qualitative research. So if you're dealing with the qualitative research, such strict criteria or rigid criteria may not be there, and you can start working on that research design from beginning. So you need not have to put your 80 to 90% of time alone on the research design in case of qualitative research, because it is a flexible research process. It is a flexible phenomena where you can add, delete parameters, you can play with the parameters, you can have, you can experiment throughout the process. You can experiment with different variables which are associated with the qualitative research. And again, you can have a mixture of quantitative and qualitative research. So there is no binding that you have to do only quantitative research or qualitative research. Okay, so you can do either quantitative or qualitative or mixture of quantitative and qualitative research. Everything is acceptable. Only thing is that the methods of data collection will be different for quantitative and qualitative. The methods of analysis will be different for quantitative and qualitative. Whatever are the quantitative aspects, you deal in a that way. You apply the parametric test or parametric data, or non-parametric test or non-parametric data. And for qualitative data, you deal with the qualitative research techniques.
So sorry to interrupt. I had a query actually.
Mhm.
So qualitative study designs, we can play with the parameters, unlike quantitative, where we have to be more stringent with the quantity of data that we are collecting. So, but when it
Mhm.
comes to analysis, is it uh, is it so that the quantitative data is easier to analyze? I mean, the numbers compared to the descriptive data that we get from a qualitative research, or
Of course, quantitative data is very easy to analyze. Very easy to analyze in terms of availability of the software. See, quantitative data, you have numbers, you are putting those numbers to software, and if you are aware how to run the software, or if you're aware which kind of tests are applicable for this particular data, it is just you have to apply that data and you will get the results. But in qualitative research, you are dealing with somebody's emotions or perception. Suppose you are dealing with a Bhopal gas tragedy. You are collecting information from, suppose, 100 families. You have collected information from 100 families and it's a written information. You have to go through that information. There is no other way. You have to repeatedly read that information and you have to draw the conclusions. You have to draw conclusions in terms of writing. There won't be any software that will help you for conclusion. You have to conclude. As a researcher, you have to conclude or you have to come with the conclusions. So analysis is easier in quantitative research as compared to qualitative research.
Also, sir, suppose if in my 3-year PhD, if I have like 3 phases, so can phase 1 have quantitative design? Can phase 2 have qualitative design? And so can different parts of the study can have like different designs? Is that possible?
Yeah, that is very much possible. So
Okay, sir.
see, there are no restriction. It is a course by research. It is not a
Hmm.
professional course. It is a course by research. So you can play with different parameters, whether you want to have quantitative, qualitative, you can work either way. There is no problem. But only
Okay,
thing
sir.
is that quantitative research design is more rigid. So first work on
Hmm.
your quantitative research design. When you have dual kind of thing, like if you have mixed design, quantitative and qualitative, first work on a quantitative part,
Quantitative
and
design.
then definitely you can play around with this qualitative research, because there is a lot of flexibility in case of qualitative research. And again,
Right.
as far as sample size is concerned, it is more rigid in case of quantitative research.
Hmm.
Quantitative research will say that you have to work on 100 sample or 120 samples. But
Hmm.
for qualitative research, it is a saturation level.
Right,
When
sir.
you achieve that saturation, suppose you decide that I want to take interview of 100 participants, you are very much enthusiastic and you want to have an interview of 100 participants. After 4 interviews or after 10 interviews, you come to know that you are getting similar kind of information. You are not getting any new information. So you have already achieved the saturation point. You will
Hmm.
decide that yes, saturation point is achieved and I am not getting any additional information. So at
Hmm.
that point of time, you can stop your research. So you need not have to, even you have decided that, or you are ready to have ready to interview those 100 people or 100 participants, you will not interview the remaining 90, because
Right.
saturation point has already achieved at
Already
the,
achieved. Hmm.
yeah, at the point of 9 or 10.